It's all right. We had 3 conversations about how we were going to do this panel, and I've slept quite considerably since then, and also travelled halfway across the world. So I just needed a small reminder as to which way we were doing it. I'm going to ask Engineer Ho initially. The first thing we're going to look at is the why. I think that's important. So why is Vision Zero a strategic imperative? So, Engineer Ho, how do we move leadership from viewing safety as a cost center into a value driver?
Thanks, Kelly, for the introduction. When I was first approached to talk about this topic about Vision Zero, a transformational approach to prevention, it took me some time to think about it. How do you approach this issue about Vision Zero and connect it with transformational approach? But after a while, I thought this is a very relevant topic because this is indeed what we are looking for. First, let me talk about what do we mean by transformation, right? Transformation is basically achieving very significant result by changing whatever we are doing. If we do not change achieve the significant result that we are looking for, usually they are not transformational in nature. They are basically incremental improvement and things like that. Now, what does transformation require? The first message I want to pass is that transformation, you cannot achieve transformation without change in mindset, right? If there's no change in mindset in whatever you're doing, how you're doing it, then you would never achieve the transformation result that you're looking for. So that's the first important message I want to pass. No transformation without changing in mindset. Then what is Vision Zero? Vision Zero to me is what the change in mindset is all about, right? Vision Zero, there's this belief that we say that Vision Zero is about believing that every accident, injury, or ill health, right, arising from work is preventable. Now, when we first launched the concept of Vision Zero, there was big argument about, is it a target zero, right? And target zero, they say that it's not very good because if you target zero, you don't achieve it, you get disappointed, and then you get demotivated. So, but then if you look at it from a point of view that Vision Zero is about every accident, injury, or ill health is preventable, you start thinking, what do you mean by that? Which means that you have to change your process about how you approach incidents, how you approach ill health that's arising from work. And this is where you have to put in place systems and processes to look at learning from past incidents, learning from past ill health that arising from work. But then it's easy to say that you want to learn from all these incidents if there's no change in mindset that you really believe in it. Because to get this incident reported and to get the right information about how this incident happened, you need people to come forward with the information. And to come forward with information readily, there must be this culture of trust. If there's no trust element in there, nobody will review. But how do you create the trust element? Right? The trust element is whenever people review all this information, I think our immediate response, especially the culture today, is to find fault. Whose fault is it? Right? Instead of finding solution. And this is where you sort of destroy the trust. In our context, there's always what you call the blame culture instead of a culture of learning. And unless all this thing is put in place, you won't be able to achieve. You will know that the mindset have not shifted, and because of that, no transformation will occur. You can say yourself is a Vision Zero organization, but it doesn't help. But to me, ultimately, at the ground level, if I want to assess an organization whether you have achieved Vision Zero practitioner, right, is when I look at whether there's a lot of like near-miss reporting. Why near-miss reporting, the more the merrier, is important is because it reflects on the culture that people are willing to bring up information, share information, even though it's some incidents or some wrongdoing. They are very willing to share this information. And that requires a work environment that people who are willing to share this information. What we learned just last week, right? I think all of us were in Düsseldorf, Germany. So if we are saying something different because of jet lag, we just came back on Sunday or so, right? And that psychological safety is one of the topics that was well spoken during the conference there. And that psychological safety is very important to have this culture of learning whereby people are willing to review information, and then we can learn from past incident and achieve this preventable culture. All right, that's all my opening. Thank you.
I think that's really important, isn't it? It's about learning from mistakes. It's about learning when things go wrong. And near misses, I always talk about near misses as they're the things that when you're on the phone to your mum about how your day was, they're the bits you don't tell your mum because she's going to worry about you. And those are really important bits for us to know and understand, because actually, if we're creating these cultures where we're looking out for each other and we're looking at, I'm looking out for myself, but I'm also looking out for you. If something happens to me and I don't get hurt, I'm actually looking out for you by saying, hey, I tripped over that yesterday. There is nothing worse. I don't know how many of you guys have had it. There's nothing worse than going investigating an incident. I had one where somebody fell over and broke their arm, and I went and investigated. And as I'm taking photos of where the individual had tripped over, I had another member of staff go, oh yeah, I tripped over that last week. And then had somebody else go, oh, watch that bit. It's a bit wobbly over there. And I'm like, how? If we'd known, if you guys had told me, we would never have been in the incident, in the event where somebody's then gone and broken their arm. And that's that responsibility, isn't it, of looking after each other. And that, yeah, it absolutely. Anyway, sorry, I've gone off script already and I'm only 5 minutes in, but it's going to happen. Carrying on with the why element. So let's talk about business cases, I suppose. So what's the quantifiable link between a Vision Zero commitment and that long-term business success? Come on. Either or. Let's go.
Well, hello?
You on? No. Hello? Yes.
Yeah, there has actually been quite a lot of research on this. And to give one example is the International Social Security Association that has investigated the companies that are doing well in terms of safety, health, and well-being culture. And what they prove by investigating, I think, around 340 companies, is that there is what they call a return on prevention. That is, for every dollar invested in prevention, you'll get a return of 2.2. And you see this in many different studies. And what they include is that it's not only the lower cost of accidents, it's not only the cost of not being compliant with the legislation, but it's also the investments that are giving a return when it comes to the attraction and retention of the best skilled workers, for example. This is a global challenge now, right? How to attract and how to keep the best workforce. It derives from investment, because many investors are now looking at prevention, not only on lagging indicators as the accident statistics. And it's also because prevention increases productivity, innovation, flexibility. And I think for companies to have a competitive advantage in the future, we need to look at how do we make our workforces thrive when it comes to getting new ideas, collaborating, and so on. So there is a very clear business case and a very solid results on the return of investment, that is the return on prevention.
I think that's brilliant. I hosted a webinar last week around working at height, and somebody put in the chat, this prevention thing is really expensive. And I wish I had I get an ROI of £1, 1 to 2.2. Like, that's phenomenally.
Yeah.
That's a great investment, and and the fact that we've got that evidence is really, really important. So I'm assuming, Dr. Aslan, I'm coming to you for this third question on this. Considering so how do national frameworks like Singapore's support and challenge the adoption of a movement like Vision Zero?
Thanks, Kelly. But before I answer that question, can I ask them a question or a couple?
No, of course,
Yes?
you
Yeah.
can.
Right.
We're doing audience participation.
So just please put up your hands who have heard of Vision Zero before today. Okay, not
Okay.
bad. Okay, now next question. How many have opened the website visionzeroglobal.net?
Of course, JC has.
Right. I think it's fair just to recall that Vision Zero was launched in Singapore in 2017. So the global launch was in Singapore, and now there are more than 11,000 companies who has already registered as a Vision Zero company coming from 130 countries. So this is a global movement of which I want to take it a little bit different from what we've discussed from morning. Ladies and gentlemen, all of us here, I think it's the same. We attended 4 or 5 OSH conferences every year for the last decade. And I think all the time we are discussing the same thing. All the tools and the systems on how to achieve safety and health. But Vision Zero is something a little bit above of that, of which this is the part where we combine everything and see what matters. And that's where the zero comes in. Because every time, this is what Engineer Ho said just now, every time we say Vision Zero, everybody focuses on the zero.
Not the vision.
Not
bit.
the vision.
Yeah.
Everybody goes on zero, and the first reaction that we get, and this is what I get in Malaysia as well, we have been doing this also since 2017 as well. The first reaction we get is, you are not going to achieve zero, therefore it is not going to work. But it is not about achieving zero. It's about that vision of achieving zero. And what is that vision? That vision means we do not accept accident. If you don't accept accident, then you will do all sort of things to avoid that accident. If you don't accept that accidents can happen, you will actually invest on the AI that we've discussed just now. Or if you don't accept accident, you will put on the system. If we don't accept accident, we go on into the culture. And that is the main point of it. So that's the main gist of Vision Zero. And there's a lot of challenge, really. I can tell you, even in my home country, which is not very far, to try and get the safety and health people. I'm addressing safety and health people today because this is a conference full of safety and health people here, not policymakers of the government. Yes. So to get the safety and health people to understand that it's not a system. This is not a new system. This is not a new tool, but this is actually a new way to look at the belief of how we are going to approach safety and health for the workers. That is a huge challenge for us. So we take 2017 until 2025, only the next National OSH Master Plan actually mentioned that we are aiming towards a zero accidents. How long does it to get this vision or to get this idea that it is not about the systems or the tools, but it's about the end game. And the end game is actually not to have that accident, because I'm from social security. Every accident, there's a person behind it. And that is the most important. Not just the person who had the accident, but also the family members who had the accident.
Yeah, I mean, I find it really interesting because Vision Zero for me, like when we started having these conversations, I'm like, Vision Zero feels really uncomfortable for me, like for me as a professional. And I sit there and go, but I've spent the last year saying that everybody deserves to go home at the end of every day of work in the same state, or maybe even better. So actually, I'm talking about Vision Zero without saying the actual words. But Engineer Ho wants to jump in on that.
I thought
Definitely.
I just add on what Dr. Aslan has said. when we first introduced, when I first mooted the idea, talking about Vision Zero in Singapore to the ministers, even to my own colleague, all these things. I still recall this incident when I talked to the minister. He said, "Are you talking about Vision Zero or Zero Vision?" In other words, he's trying to say that now that you don't know what to do, just don't think anymore. You got nothing, right? And of course, I say it's really about Vision Zero, right? About how we want to move towards there. Then the other thing is that I think you often heard about politicians that always say, one death is one too many. But when we talk about targeting zero, they will say, oh, that's not practical. You never achieve it. But then how does these two sentences gel with each other? How they align? It doesn't gel, right? And that is one of the things that I always find a dilemma in talking to people in the public. When you talk, you say one death is one too many. On the other hand, you say achieving zero is not possible. But I think what Dr. Aslan has said, and we share the same view, is that it's about the vision, it's about changing the mindset, it's about how do you prevent every single accident and ill health arising from birth, so that we put in place systems and processes to learn from it so that we can prevent the next one, right? Thanks.
Neil?
I don't know if you are asking this question later, but just what I think is important about Vision Zero, that it's about looking at leading indicators instead of lacking indicators. Because we are so used to looking at accident statistics and maybe even near misses, although this is a little bit more leading indicator. But Vision Zero is about how can we measure the good processes we have for prevention in the companies, so that we can change also the mindset of the boards and the senior management to not only look at zero accidents. This is what creates the psychological unsafety, because we are always hiding what is really going on, how the work is really done. But if we start measuring on leading indicators, and you can find a lot of these in the Vision Zero guides that are freely available, we will measure what are the good actions of the managers, what are the good actions of the employees, and this will start create this culture, this prevention culture, this transition to a new mindset. So I think this is really essential in the Vision Zero mindset.
And that's brilliant, and leads us really nicely onto the how bit. But no, don't shrug. I love it. I love it when a panel does what I want without me having to tell them that that's what I want them to do. It's great. So and open out to any of you. Implementation. If some people are sitting there going, yeah, I'm interested. How is it that I start to do this? And we're going to talk about the first steps of implementation. We're going to mention the 7 golden rules, which I'm sure JC can kind of talk, shout out kind of from rote, and then leadership walk the walk as well. So let's talk about those first kind of crucial steps. I suppose the first one is kind of around actually convincing people that this is the right way to go.
Right. Zero. That's the first start. So Vision Zero, not zero vision.
Yeah.
Okay. That's the most important. I think, and this is interesting because I assume that all of you are from companies, and you're going to go back and try to convince, after this excellent exhibition, try to convince your company next year we are going to achieve what. Okay. I'm going to go back and try to do the national numbers, so going to be even bigger. But you guys are going to go back to your company and try to convince your CEO or your top management, so next year, boss, we are going to have only 1 death and 30 accidents. Is that acceptable? It's not acceptable, right? So the first bit is to convince that it has to be zero. So I think even from before, when you go back to plan for next year, you're always going to say the same thing. We do not want any accident next year. We do not want any accident. What are we going to do? We are going to prevent all accidents. So what are the rate that you're going to accept? 1 death. It doesn't work.
Do you know, when you say it like that, it sounds so ludicrous, doesn't it? It's like, how many deaths are we going to have next year?
So-
1. It just sounds so ridiculous.
Yes, because one death, if last year you got 10 deaths, one death is 90% reduction. That's bonus, huge bonus, man. But that is not acceptable, isn't it? So regardless whether you achieve 1 or 2 or less, the idea is always have to be that you do not accept that death. And then you take it even further and say, we don't accept accident. We don't accept one industrial accident in my workplace. We don't accept that, no, next year we must put to everybody, next year we're going to go 0 accident at the workplace. That is the mindset that we wanted. That's a huge challenge. And it's not easy to convince people that it can be done, or it's not easy to convince people that we can take actions so that it can happen. And that relates back to the leading indicators. Because now you all have heard of leading indicators for more than a decade now. But why leading indicators is important? Because you wanted to have leading indicators so that you can achieve that goal. We do not want to have to do all those leading indicators, to do all those activities so that we can achieve that 1 death. Doesn't work, right? So we are doing it so that we don't have any accidents. And that is the biggest challenge, I think, to do it, to actually convince our top management that this is how the goal is supposed to be. But I have just thrown it to you. I think if you push the same argument to your top management or your workers, they will actually agree with the same thing. It's just whether they are going to do it or not. So we have to persevere and keep on saying that. And that's what we did for 10 years.
I suppose it's that flip it on its head. I'm going to come to you in a second. I suppose it's that flipping it on its head rather than go, like I'm going to introduce Vision Zero in my company and this is kind of the idea, and you're going to get a load of people frowning at you and being very skeptical. So you flip the question and go, okay, board, okay, leadership team, okay, workers, how many of you is it okay to kill this year? Do you know, like actually flipping it around? Board, how many workers can we kill this year and it be okay? Like, because actually the answer is going to be none, obviously.
But we can make it a little bit easier though. So trying to say this as an idea is quite tough, which is why the global movement is here.
Yeah.
So this is why there is a branding of Vision Zero. This is why I'm wearing this cap and this patch here. Basically, so that to make it easier, they say, hey, let's register as a Vision Zero company. Let's join this global movement of which 130 countries has already been in. Let's join companies, big companies, many companies. You can check the list who are already a Vision Zero company. Then that might make it easier for you to push this agenda, because now we are part of a global movement rather than you trying to get and convince 0 is the number. It is logical, but it's something that is logical, not always easy anyway, isn't it? So that's how I will frame it.
Right.
Yeah, my company works with implementing Vision Zero in companies, and we have usually 3 ways of starting if a company wants to work with Vision Zero. And one way is, you briefly mentioned the 7 golden rules. Are you aware of, do you know the 7 golden rules? Yeah? Please raise your hands. How many people know the 7 golden rules?
I was teasing, JC, like
Okay.
we're not going to test you on them.
No. Okay, so I guess we don't have time to go through the 7 golden rules, but these are evidence-based ways of increasing the prevention level in a company. And you can also download these golden rules for free. And what we do in a company is to start just going through these 7 golden rules and to see if there is a gap somewhere. So this is a simple exercise that every IOSH professional can do to start a discussion in the company. Where do we perform well on these 7 golden rules, or where do we not perform well? So this is a way to start. And the argument is that companies working with the 7 golden rules will have a higher prevention level and thus fewer accidents in the long run, or health-related issues or well-being issues. So this is one way of doing it. Also, sometimes we do questionnaires in companies, and you can find some of these questions in the Vision Zero guide on well-being. That is about, you assess what the management levels and the employees think about the prevention level in the company. So how do they see the prevention level? And interestingly, we always get the result that the management level sees the prevention level more positively than the workers. So do we then have a common culture if we don't see the world in the same way? No. So this is also a way to start a discussion. And the third way is that we do meetings for management, or you could do the meetings for the management in a simple way, asking why, what, and how. Why is safety, health, and well-being important to your business? What is it that you need to do to increase the prevention level, and how do you do it? Because surprisingly, many management groups do not know what does good look like. They know how have we done it for many years, a compliance strategy. Many companies still do this. But if we want to have a really a commitment strategy that is based on values, many management groups do not know what to do, specifically what to do and how to do it. How do you change a culture? How do you make this embedded in your company? You need to know what to do, right? Instead of we're just talking about it. What specific actions can you take to make this happen?
Yeah, maybe, can I add on?
Of course you can.
Yeah, thank you. I think just now when I asked whether you know the 7 golden rules, hardly anybody put up the hand, right? It's just 7 golden rules. It's just a 7 category of items that are to show you if you tackle on these 7 items, you are able to achieve something out of it. But to me, I have a very simple way of describing the implementation process about this Vision Zero. And this is about the story about the 3 ships. When these 3 ships come into a harbor, into a company, you know you roughly you are there. The first ship we are talking about is ownership, right? If you don't have ownership, you will never be ever going to achieve the concept of this, the culture of Vision Zero, the culture of prevention. Because ownership is so important. A lot of people want to achieve safety and health because there is a law, because there's an enforcer coming to you, going to give you a fine, going to send you to jail, and there's no ownership. There's mere compliance. Mere compliance will not help you to achieve the level of Vision Zero that we are looking for, right? So it must be a case where by ownership, you want to be safe, you want to be healthy, right, at work. You want to do it not because I need to do it. So that's the first ship that you want to look at whether it comes in. The second ship you're looking at is leadership. And leadership is the most important because you got to lead by example. At every level, the leadership must be there to show how this can be done. And leadership is important to know that first you must know the way, how to achieve it, right? Then you have to show the way, how to show the way to go and achieve it. And finally, go the way together with everybody to achieve the outcome that we want from Vision Zero. The final ship is not the least final ship, and also very important ship is so-called a partnership, because Vision Zero needs to be done in partnership with every level of the organization, whether together with the workers, to the supervisors, to your contractors, to your the suppliers, the vendors that come in, because it's only through partnership where people can work together, achieving the direction that we want, then you can be there. So to me, the implementation phase, just look at this 3 ship: ownership, leadership, and partnership. Yeah, more or less, you'll be able to formulate something out there and move ahead. Thank you.
I absolutely love that, and I am definitely writing that down the second I'm off this stage. That's brilliant, because actually it is right. It's not, ownership is like everybody wants the same thing. Leadership is this is how we do it, but actually you can't if you're dragging your workforce with you kicking and screaming, like I don't know how many of you have got toddlers. My nephew has just turned 5, and if he doesn't want to do anything, he turns into a rigid board. He's just like, it's like, it doesn't matter if you need him in the car seat, he ain't moving. Like, if you're having to do that with your workforce, like that's not, like, you're punishing them, aren't you? You're not actually ever going to make them do what it is that you want, which is for their own good, like putting them in a car seat. But anyway, we've gone massively off topic, as I always tend to do at this time of the afternoon, because it's definitely coming to coffee time. Okay, so speaking of the ship of leaders, the leadership walk the walk and walk the talk, etc. So what are some of those tangible examples, any of you, what are some of the kind of tangible examples of effective leadership commitment at that kind of level? So when you walk in to a place and they're looking at Vision Zero, what are the things from leadership that you see that make you go, yeah, you're on the right track already? Everybody's being polite now.
Yeah, actually, I think from the research on Vision Zero, which has been done in companies, there are 2 things that defines a good prevention culture and a good leadership. The one thing is that the managers are doing safety walks, not safety walks, safety, health and well-being walks, but not from a compliant way of doing it, just with a checklist checking that everything is okay, but managers are actually speaking to people on the shop floor, asking them things like, if I should do your job, how could I do it in a way that makes you feel safe, healthy, and in a good spirit? So open questions like this. Or if I should design your job in a more efficient way, because, and by efficient we mean with a high degree also of safety, health and well-being, but related to productivity, what are your good ideas for this? So we need to teach the managers to ask other questions when they are out doing a safety walk. This is one thing that is documented from research. The other thing is that we need safety, health and well-being to be part of meetings, but not just a short safety brief, or not just, but now we are going to talk about safety. Do you have any issues today? And everybody is saying, no, I don't have any issues today. No, we need to teach managers to really talk about safety, health and well-being by providing them some themes that they can discuss with their employees. And this, even when I talk to, for example, factory managers, they want to do this, but they have no idea specifically what type of topics they should put in the meetings. Because talking about prevention, we need to teach people what does this mean. So we need to provide them with the kind of topics that they could discuss at these meetings. You talked about learning. That could be one topic, right? That you start talking about what did we learn? What can we predict? How could this work better? This collaboration in the team, or whatever the question is. And many managers, they say, but I'm not, how can I talk about culture or learning or knowledge sharing? I'm not a psychologist, I'm an engineer. And this is why we need to define already the questions and the themes that so they feel comfortable in discussing these themes. So we as IOSH professionals have some work to do in defining other things to talk about. So good safety, health and well-being walks and talks.
I think as well, it's not, I've gone massively off topic now. It's not just the talking, it's the listening.
Yes.
Like managers, like a lot of managers, I don't know whether it's the same here, but for us, a lot of managers are promoted because they're really technically capable, but they're not always very good people managers. And actually, so it's yes, this is the thing that we're going to discuss. But if you are going to discuss it and all of your thoughts are written on your face as a manager, you're probably not going to get a huge amount out of your team, are you? Yeah. So, do we have any questions in the audience? Got one over there. No, it's fine. I'm gauging how much time I've got for Q&A before we actually move on to our third topic, because we're definitely lost time. Let's throw your question in while I've asked you already. Let's go for it. Thank you.
Thank you. Good afternoon. Okay, my question is basically about what are we seeing with Vision Zero? I came all the way from Nigeria, by the way. My name is Nsekan Ikono, and I actually wanted to come here and also learn a little more of what's happening in the Asia environment relative to prevention. So I don't know if you have Nigeria as part of the Vision Zero. You mentioned you have about 130 countries, right? And I'm sure it will be a lot of companies. Do you have statistics that shows that we have companies that actually can achieve zero hearts?
Okay, so if I can just summarize your question, because all the speakers are pointed towards you guys, it's quite difficult for us to kind of hear. So if I can summarize your question, I'm looking at you just to make sure that I've got it right. The question was, is there any companies from Nigeria that are part of the Vision Zero? Is part A, and part B is, have we actually got any companies that have achieved Vision Zero yet?
Okay. Nigeria is one of the countries with companies that already registered
Yes.
with Vision Zero. So congratulations. But the next question is interesting. This is the question that we get all the time in the beginning when we started Vision Zero. So who has achieved zero? I think we have already explained that. It is not about zero. It's about the vision of achieving zero. So that is the most important. I wanted to also add on to Pernille's answer just now.
Go for it.
Because that when you walk into a company and then you wanted to see, have they gone into the Vision Zero mode? Can I say that? Okay.
Yeah.
So what are we looking at? So basically, we're looking at what they're doing is more than what is actually being done under the current safety management system that is available. One challenge that I always have when I speak about the 7 golden rules from safety and health people is that they will say another system. You know, because they've just gone through OHS 18001 and now ISO 45000, and before that in my country there's another standard. So now here this guy is talking about another system, which is it is not another system. And the reason why I like the 7 golden rules is there are, number one, that is not in the golden rules is following the law. There's none in the 7 rules say follow the law. Yeah. We have been speaking about safety and health culture for a long time. And today, I think the whole session is about the safety culture. How are we having a culture when only a niche group of people understand what is it about? So that's why the 7 golden rules are actually quite open. The first rule, demonstrate leadership. Can be of anybody. Second rule, identify hazard. It doesn't say that you must do a hierarchy or a very special way of hazard identification. You say identify the hazards. Third rule says set your target. It doesn't say zero, it just says set your target. Fourth rule say create a safe and healthy system.
I've got that one written down.
Workplace.
It
Fifth
says
rule
ensure a
says-
safe and healthy environment.
Yes.
Is that for
Okay. Fifth rule says make sure your machines are safe. Sixth rule says invest in what was it? Rule number 6 is about
Competences.
qualifications.
Yeah.
Okay, get your people qualified. And 7th rule is invest in the people, ownership, the first ship. Basically, it is a very generic rule or a very generic guide that people can follow so that everybody, not just the safety and health people knows about safety and health. The workers knows about safety and health. The managers knows about safety and health because it makes it more generic. And if when we go into the company and everybody can talk about that 7 area, rather than having to call the SHO to actually explain what is your system of safety and health. And that means the company is moving towards zero. They're not yet zero, but they're moving towards zero, and that's the vision.
But I suppose as well, just to add, the idea is like actually, like, a lot of companies achieve Vision Zero for a day, or for a week or for a month. But actually, like, at what point do you know you've achieved it? Because I might not have had any fatalities or incidents today. But that doesn't mean it's not going to happen tomorrow. And I think it's that thing of actually, I feel like I've been converted in the past, for 40 minutes or so. Like, I feel like I'm suddenly like, oh, I get it now. That actually it's not about the achieving it.
Yep.
It's the journey of going,
Yes.
This is what we want. We know that's idealistic, but actually this is what we want fundamentally.
Kelly, the first video that was produced in 2017, when we launched the Vision Zero, it says we believe. That's
Belief,
it.
yeah.
We believe. So it's a belief.
And for me, it's actually the opposite of zero accidents, in the sense that we have to move away, as I said before, from the lacking indicators of only looking at accidents to the proactive, to the leading indicators, right? So this is journey towards a higher prevention level. And in order to move to a higher prevention level, we work with the 7 golden rules. And for me, these are, if you have the ISO 45001 system, the 7 golden rules is the culture equivalent of this. So it defines how you work with a prevention culture. And it is a language, I agree with you, that everyone understands. Managers, workers who are not technical in the sense of working with the IOSH management. This is the strength of it.
So maybe I just check with the audience a bit. In your own organization this year, how many have 0 incidents, 0 accident this year? I'm sure a lot of you have 0.
Surely.
You mean all of you have something happening? Yeah, because they're big company and small company. But in my recollection, what I know, in Singapore, I think almost 80% of the company don't report any accidents, right? Whether they have or not, that's a separate issue.
Yeah, and I think that's sometimes a thing, isn't it?
In most situations, it is indeed they have 0 accident, indeed. Because, as you say, you can achieve 0 this year. How about next year or the year before? All right, you may not. The more important thing is focus on the vision, that what are you doing to make sure that things does not happen in future in a sustainable basis. The transformation we are talking about is not only the transformation in getting the higher outcome, better outcome, but the more important thing is on a sustainable basis. So that part is also very important. Yep.
Brilliant. So, Peniel, what are your top 3 leading indicators?
I actually already mentioned them, because we know from the researchers behind Vision Zero that one leading indicator is manager walks with talks on safety, health, and well-being.
Talks.
And if you look at the proactive leading indicator guide in the Vision Zero webpage, you will see that you can have different ambition levels for these leading indicators. Very shortly, because you can measure how many manager safety walk and talks do you perform. But that could be a compliant thing also. You can just check, yes, I did a management walk today. But you can also measure what came out of it, what was the outcome of this. How many preventative measures have you implemented following the walk? And did these measures work? So there are different levels of maturity, you could say, for these leading indicators. But you can start just measuring the new behavior that you would like to measure. This is the one. The other one I already talked about was having safety, health, and well-being as themes in meetings, where you can define, again, the ambition level that you would like to have. And the third one is, we have in the Vision Zero Guide for Wellbeing, we have developed a maturity scale model where you can assess whether your company is at a passive, reactive, active, proactive, or creative level when it comes to prevention. And some of the companies that I work with, they make this a quantitative assessment among the employees and managers to assess the prevention level and use it as a leading indicator or a KPI over years to see if we increase the prevention level according to our workers and our managers. So these would be the three that I would recommend.
So walks, talks, and we love a culture self-assessment in IOSH, don't we? We love assessing how we are on a bell curve somewhere. No, brilliant. Any other? I mean, Dr. Aslan, you very wonderfully quoted. And pretty well. I mean, he said them with confidence. The 7 golden rules. That can feel. I suppose 7 feels quite straightforward, but if you had to pick one for us as health and safety practitioners and professionals who haven't necessarily got our heads around the full thing fully, which one would you turn around and tell us that we have to go and look at?
All right. I think first I will make a statement that all 7 is equally important. Yeah. That's a safe statement first. Okay. And it's true because I also do safety and health audits. And in all the audits that we do, those elements are there anyway. What are the leadership commitment? What are the hazard identification being done? How much? What are the training being done? How much? But in all those audits that I did, when you look at the checklist, the longest questions is on the hazard identification and also the mitigation on the machines. Leadership commitment, if you come to the meeting, you get maybe 70% of the points already. Training, if you plan something, 70%. If you actually execute your plan, then you get full marks. But basically, what I'm trying to say is there's a lot of emphasis on the machines and the systems, but less emphasis on the leadership, on the investment of the people, on the audit, on the qualification or training, which is not what happens with the 7 golden rules, because the 7 golden rules put the first shape on top, which is the leadership. But leadership can also be on the worker side, isn't it? So that's why you have to train your worker so that they can also do the leadership on their side as well. So I think in the end, and with any other companies that I know of, the leadership has to be the most important rules.
Right. No, thank you, Dr. Aslan. And just before I wrap up with some of our key takeaway messages, Engineer Harry, have you got any kind of final thoughts in some sort of Jerry Springer way, without the fighting?
Just a round up that earlier when opening, I said there's no transformation without the change in mindset. I think the first thing we must always remember. And Vision Zero is about the changing of this mindset. It comes about. If you don't change mindset and say you are Vision Zero, I don't think you'll ever achieve it. Right? The third thing is at the ground level. How do you see this manifested at the ground level? Whether people walk the talk and do the things, and you have a culture of trust among all the various levels of the staff, that people can talk about safety and health freely without being feared or being penalized, or even having a blame if something really happened and you want to review it. Thank you.
No, brilliant. So thank you to my fantastic panel. And let's try that again, shall we? Need coffee now. Engineer Ho, Pernil Tao, and Dr. Aslan. So safety drives value, not cost. Transform our mindsets. Vision Zero is the ethical and operational engine for business success and sustainability. Let's lead with trust, not blame. Fostering cultures of psychological safety where workers are empowered to report and stop work without fear. And measure what matters and be proactive. Pernil's wonderful leading indicators rather than looking at our lagging indicators. And protecting the whole worker. Success means looking beyond the physical risk to include our occupational health and total worker well-being. Please put your hands together for this fantastic panel. I'm sure we will continue conversing for a lot longer. And definitely go and check out Vision Zero website if you have not already. Thank you very much.